Hi, everybody, and welcome to our webinar from Asian Americans Advancing Justice on AAPI Communities and Public Charge. Today, we're going to go over public charge and how to talk about public charge with your community and your families, and then how to take action. Today, we are joined by experts from Asian Americans Advancing Justice, LA, and AAJC, who will go over everything from the historical context to who exactly is impacted and to talking points. So at any point in the webinar, you can feel free to use your GoToWebinar dashboard or the chat box to ask any questions, and we will have the opportunity for you to ask questions at the end. And you can also raise your hand using the dashboard at the end if you would like to raise your question verbally. And with that, I will turn it over to Reshma to go over the historical context.
Hi, good afternoon, everyone, and thank you for being here. I think, as you all know, since taking office, the new administration has been targeting immigrant communities with a range of proposals and rhetoric that are creating deep fear in immigrant communities. Deep fear in immigrant communities, and really, I think, has laid the groundwork for where we are today. Earlier in 2017, the Trump administration had leaked a couple of proposals around public charge. We saw another leaked version later last year, and that stoked a lot of fear in immigrant communities around, has a public charge rule been released? Has the law changed? And I think as a result, we have actually been in a long period of time where there's a lot of confusion amongst immigrant communities about how their use of public benefits is going to impact their applications for green cards. So that's why now more than ever, it's really critical, you're going to be hearing about this today, that we act on the rule that was released in the Federal Register on October 10th. And we have an opportunity to provide public comments through December 2018. Just for some background, public charge has been a part of our immigration laws since 1882. And, as we all know, that was a time of deep xenophobia. It was the same year as the Chinese Exclusion Act. And since then, the law has basically been interpreted in the same way for more than 100 years. And there was some field guidance in 1999, but for the most part, it's been quite uniform through now. And so I think the deep cause for concern is that immigrants don't really know what to expect. And we as advocates, we as their advocates, really both have to have a strong understanding of prior public charge rules, what we have in place now, and how it might change, as well as what we can do in the couple of months ahead in order to fight back. So with that, I'm going to turn it over to my colleague, Hang Lam Fung, who is a senior policy manager with Asian Americans Advancing Justice Los Angeles.
Thank you, Reshma. Good afternoon, everyone. I am going to give a quick overview of the public charge test as it is right now and what is showing up on the proposal that was issued on October 10th. So currently, an immigrant can be considered a public charge if he or she primarily relies on government cash assistance to support his or her daily expenses. So the present definition reads, a person who's likely to become primarily dependent on the government for subsistence. The October 10th proposal wants to redefine the public charge test to apply to immigrants who receive one or more public benefits. This is a startling departure from assessing a person based on his or her primary reliance on government for subsistence to simply his or her likely use of public benefits. Now, it's important to note that this proposal is forward-looking, and it will only take into account benefits that are used if and when the proposal is finalized. It will not consider benefits that have been used in the past. And at the moment, the only two benefits that will be considered is cash assistance and long-term institutionalized care. Next slide, please. Thank you. So you can see current benefits considered, number 1 and number 2, cash assistance and institutionalizations for long-term care. Now, the October 10th proposal by the Department of Homeland Security wants to add not only more benefits, but also a stricter public charge test that weighs certain factors more heavily. So there are negative and positive factors. But let's look at the list of benefits that will be included. And these include some health, nutrition, and housing programs, such as non-emergency Medicaid, known as Medi-Cal in California, Medicare Part D, low-income subsidy, which helps low-income seniors afford prescription drug coverage, SNAP, or the Supplemental Nutrition Assistance Program, or food stamps, and Section 8 housing vouchers, as well as subsidized public housing. Next slide, please. Now, to be clear, that those are the only 4 benefits that are included in the October 10th proposal. Public benefits that are not included that might have shown up in previous leaked proposals, but not included in the most recent proposal are, some of them are, WIC, or Women, Infant, Children, Head Start, school meals, student loans, LIHEAP, the Energy Assistance Program, transportation vouchers, ACA subsidies, disaster relief. Now, CHIP, the Children's Health Insurance Program, was not included in the proposal text, but DHS is seeking recommendations on whether to include it in the final rule. Next, we're going to talk about the totality of circumstances test. Next slide, please. One more. Thank you. So the current public charge test is a totality of circumstances test. Now that means that public benefit use is considered alongside a whole host of other factors. And you can see the list here: age, health, assets and income, education and skills, family status, and affidavit of support. So it's certainly a balance of factors and not simply if someone has been using public benefits. We are going to go through the list over the next few slides and what's been changed. Next slide, please. So the October 10th proposal adds a detailed set of negative and positive factors to be assessed to the existing totality of circumstances consideration of age, health, assets, education, family status, and affidavit of support. So, I'm sorry, can we move to the next slide? So we'll start by looking at age and what's going to be changing in terms of considering it based on negative and positive factors. The proposed rule favors working age adults. So being in between the ages of 18 and 60 is considered a positive factor, while being too young, if you're younger than 18, or too old, being older than 61, are considered negative factors. Next slide, please. We're moving down to health. So when it comes to health, the proposed rule considers any chronic or pre-existing condition to be a negative factor, especially if the individual is uninsured, lacks health coverage, or if the conditions are going to be expensive to treat and will cause the person to miss school, to be unable to work, or be unable to care for themselves. Next slide, please. The proposed rule also discriminates against immigrants who are lower income by heavily favoring individuals who have incomes that are 250% of the federal poverty level or higher. 250% translates to approximately $62,000 for a family of 4. And this is beyond the reach of many families in our community. Let's see, a positive factor also is a person's ability to cover really reasonably foreseeable health conditions. And that can include having the capacity and income to pay for private health insurance. Now, what are negative factors? The negative factors will be really individuals who have incomes of less than 125% of the federal poverty level, and that will be about $31,000 for a family of 4. It will also consider a negative factor, individuals who have applied for fee waivers, who have less than a good credit history, who might have lots of debt, have missed payments in the past, and have little money in their savings account. Next, we'll move to education and skills. Next slide, please. Under education and skills, you can see the positive factors are individuals who have stable employment histories, have high school or secondary school diplomas or advanced degrees, have occupational skills or professional licenses, and individuals who are fluent in English. Conversely, not having a high school or secondary school degree and being limited English proficient are considered negative factors. Next slide, please. Now we're moving on to family status. Now, household size will be considered a part of the family status factor. Per the language that's in the proposed rule, quote, the number of people in the immigrant's household has an effect on the assets and resources, and in many cases may influence the likelihood that the immigrant will become a public charge. So immigration officials will use the household size to determine if the household income is sufficient to support the number of people within the household. If the immigrant applicant has U.S. citizen children, they will be counted towards the household size. But the public benefits used by the U.S. citizen children will not be a factor in the determination of the applicant's public charge. So a negative factor is the inability to support a household as measured by income, and the positive factor is the ability to support the household as measured by being above the 125% for the federal poverty level. Next, we'll talk about the affidavit of support. Next slide, please. The last factor here is affidavit of support, and it's what an affidavit of support is it's a document or a contract that a person signs to accept financial responsibility for another person. In this case, it's usually a family member. Although not heavily weighed, an adequate affidavit is a positive factor and will include the consideration of the sponsor's income, assets, resources, and the relationship with the applicant. Now, if we look at all the details that have been introduced in the past few slides to the totality of circumstances test, it is clear that people who are younger, healthier, without pre-existing or chronic conditions, who have better education, who've been fortunate enough to have better education, who have more money or financial stability, and speak English well are considered more favorably, while people with lower incomes, people who do not speak English fluently, people who are older or under 18, people who have pre-existing or chronic health conditions will be considered less favorably. So these are negative factors that might be considered when the public charge test, in the public charge test if the proposed rule were to become finalized. I'm going to pause here, and Megan will share more details on the immigration aspects of the proposed rule, starting with groups of people who will be affected and those who will be exempted. Megan, on to you.
Hi, everyone. This is Megan Estahab. I'm the Director of Immigration Advocacy at Asian Americans Advancing Justice, AAJC. And I'm going to talk about what immigration categories are impacted by the rule. So not every type of immigration application is subject to the public charge test. Some are, some aren't. So, this first slide shows that people who adjust their status to lawful permanent residency through family relationship or an employer will be subject to the test. So, what we expect is that the family sponsorship categories will probably be hardest hit by the rule because a lot of the employment-based categories already require people to have higher advanced degrees and they're higher paying jobs that are probably offering health insurance, et cetera. Although if someone had a, say someone's getting a sponsored foreign employment-based visa and they have a spouse or a child who has a serious illness or disability, they could run into problems under the test as well. But, we do see, because we know this administration has been trying to attack family-based immigration and cut family-based immigration through Congress. And since Congress did not pass this white nationalist agenda, we see this as a way to attack family-based immigration administratively. And then just a note on people outside the country will also be subject to the test. So we talk about people being inside the country as adjusting their status, and then people outside the country who are sponsored for family or employment or visas will also be subject to the test at the consular level. So this just gives you an example, and the first question to ask is the person actually subject to the test? And so this example of a grandmother taking care of her grandchildren, maybe she hasn't been paid for this work, and then her daughter wants to sponsor her for a green card. We don't have a lot of facts on here. We don't know if she's over 61, it could be a problem. If she has any health conditions, it could be a problem. We know that she's not in the formal economy. That's a negative factor. But the first question is, yes, she's subject to the public charge test because her daughter is sponsoring her to adjust her status to a green card. So people in the US we'll see are undocumented people adjusting their status. People with temporary protected status could be getting sponsored by a family member. People with DACA could be getting sponsored by a family member, and they would all be subject to this test. That's different from applying for DACA or TPS or extending your DACA or TPS. Those are, they won't be subject to the test at that point. It's when they go to get their green card that they will be subject to the test. And then non-immigrant visas, most non-immigrant visas, people outside the US will be subject to the test. We'll go through the exclusions, the categories that are not subject to the test in a minute. But just the example is people who apply for H-1B visas outside the country will be subject to the test. And then non-immigrants who are in the US and are changing their status to another non-immigrant status or applying for extension. So someone's on a tourist visa, changing to student visa, or vice versa, or if someone's on a student visa, changing to an H-1B visa. At that point, they would all be subject to the public charge test. So people who are already lawful permanent residents are not subject to the test when they naturalize, but this is probably like the trickiest part of the immigration part of the rule. Lawful permanent residents or green card holders who are outside the United States for more than 180 days, when they come back in to seek admission at the border, whether it's an a land border, they would be subject to the test, which is very concerning. I mean, it's troubling to start with, but it's very concerning that Border Patrol agents would be doing this analysis. We don't have a lot of faith in them. And we haven't seen any guidance on that yet, but probably will be some forthcoming. So we really don't want to scare lawful permanent residents away from seeking public benefits that they're qualified for. We just want to make sure that they know this 180 days rule, that they should really try to avoid staying out of the country for 180 days. And of course, if they can naturalize, that would take care of the problem. So we want people to naturalize when they can. So here's a list of when the public charge test does not apply. These are the most common categories. It doesn't cover everything, but refugees and asylees, the test does not apply to them, and they are eligible for more benefits than some other immigrants. So, we want to make sure that's clear. Same with survivors of victims of domestic violence applying for VAWA. People who are victims of certain crimes can apply for U visas, and people who are victims of trafficking can apply for T visas. And those folks won't be subject to the public charge test. Special immigrant juveniles are not. And I'll just repeat what I said before. If you're applying for TPS for the first time or extending your TPS, not subject to the rule. And if you're extending DACA, right now people can't apply for DACA for the first time, but when they renew their DACA, they're not subject to the test. And then again, it does not apply to naturalization applications, does not apply to naturalized citizens. So here are a couple other examples. And again, the first question we want to ask is this person in this immigration category subject to the test? So if we look at Mr. Kim, he's 62 years old. You might see a couple negative factors for him, but because he's a naturalized citizen, he's not at all subject to the test. So we don't have to worry about any factors. Same with the Burmese refugee example. You see some negative factors, but because she's a refugee, she's not subject to the test. One point I should have noted, sorry, on the last slide though, is someone who has VAWA or one of these other statuses, U visa or T visa, might say, hey, now I have a relative who can sponsor me for a green card through family-based. Then at that point, they would be subject to the test. But so mainly people should definitely seek advice from an immigration attorney or a BIA representative person before applying for immigration benefits, especially in this anti-immigrant time we're living in. And then again, we know that the test will be applied abroad by the State Department. We've already seen some policy changes at the State Department, screening people for a public charge, where they're getting stricter about affidavits of support, which are, has mainly been used for years to overcome the public charge rule. It's just a requirement that someone financially sponsor the immigrant and say, this is my income level, and if this person is unable to take care of themselves, I will pay for their sustenance. Well, now they're getting stricter about that and requiring that person who submits that affidavit of support is a closer relative, and they're starting to already be stricter on the public charge analysis. But we do expect more guidance from the State Department on how they're going to implement this rule once it's final. And with that, I'm going to hand it over to Dorina.
Oh, thanks, Megan. I'm Dorina Wong. I'm the director of our Health Access Project at Advancing Justice in LA. So what I'd like to do is just share a little bit about maybe a little bit of some statistics to show like the extent of the impact on immigrant communities, on our Asian American and Pacific Islander communities, as well as maybe go over a couple more scenarios similar to what Megan did, and then maybe how we should be talking to our communities about this and some of the messages that we hope will be helpful in persuading the public officials and the government why this is not good. These are not good proposed changes. So first, some of you may already know this, but about 1/4 of the U.S. population are immigrants and their families, and there's about 10 million U.S. citizen children that have at least one non-U.S. citizen parent. Now, how this impacts the AAPI communities is about 1/3 of those who are trying to get their green cards or get lawful permanent status are from Asian and Pacific Islander nations. Now, 40% are based on families, so they're family-based immigrant visas from API countries. About 54% of all employment-based immigrants are from API countries. And when you look at just one of the programs that they're going to start looking at, which is Medicaid, there's about 1.4 million AAPIs who receive Medicaid and or CHIP. So that impacts about 182,000 children. And then again, specific to the API community, 983,000 of U.S.-born children live with Asian AAPI immigrant parents. So we can see from just looking at the statistics overall, this will in fact might impact millions in our communities. Next slide. And so, next slide. Hello? Can people hear me? Hello?
Yeah, we can hear you.
Oh, okay. Okay, sorry. Can you go? I'll go back one slide. I'm sorry. There. Yeah. Thank you. So because there's been so much concern about this, there have been some reports that have been done to see what the impact might be. And there was a Center for the CAP has produced a report to show that if we use this new test, more than 100 million people, or about a third of the U.S. population, this would include immigrants and citizens and non-citizens, would fail this new restrictive test. There was also another report done by the pediatricians and parents to see what they have been seeing, with their patients and how they're looking at the impact of public charge. And they have seen growing concerns about racism, fear of detainment, leading to serious or chronic children's health problems such as chronic stress, depression, anger, attachment disorders. So we know that there have been already some impact on our children. So these recent changes, just in these policies, in all of the range of policies that are attacking our immigrant communities, and the rhetoric and the attitudes have produced what we have seen to be a chilling effect on all immigrants. And that has led to decreased use of public benefits, decreased enrollment in the public benefit programs, and increased disenrollment from these vital health, nutrition, and housing programs. And this is regardless of their legal status, because this is so confusing and complicated. People may not understand that it only impacts, certain groups, like, when you're adjusting your status or when you're trying to gain entry. Next slide. So when we look at what the proposed public charge rules will do, we can predict that it will ensure a sicker and poorer country because of the potential harmful health outcomes. So we can anticipate increased obesity and malnutrition, and increased communicable diseases, and certainly because people will not have a source of care, they will likely go to the emergency rooms as their primary, primary, as they say, source of care, because they won't have health coverage, just as we've seen pre-ACA. There also will be increased rates of uncompensated care because people, again, will not be using these Medicaid, and will cause the lack of health coverage, which will lead to increased costs. It will also lead to increased costs to healthcare providers, healthcare facilities, hospitals, and clinics. Clinics will have to take up the slack when people don't have health coverage, as they have always done. It will also increase the rates of poverty. People will be sicker, so that they will not be as productive, and kids won't maybe have adequate nutrition. It'll reduce their learning ability and educational attainment. And it will also, because people won't have shelter, increase the homelessness population. Next slide. So let's look at just a few scenarios. let's say a VAWA recipient was using public benefits, using Medicaid or food stamps, but had a citizen, U.S. citizen brother. Megan had mentioned this. As you know, as we have said, VAWA petitioners are generally exempt from public charge. So if he or she went through the regular process, she or he would not have to worry about public charge. But if they wanted to go through the U.S. citizen brother, then they would then become subject to the public charge test. And so the immigration officials might look at whether or not the VAWA recipient had adequate income, but whether or not they were limited English proficient, and whether or not they had any kind of pre-existing or chronic health or serious health condition. And then similar to all the different ways that you can evaluate this issue, this factor, whether or not they had they could take care of themselves or it would prevent them from working or going to school. And then, of course, whether or not the VAWA petitioner used public benefits. So, as Megan pointed out, we would recommend that somebody in this particular position, if they had a choice between going through, adjusting their status, to different options to adjust their status, they would probably want to go see an immigration attorney, somebody who could give them advice on how these negative factors might be balanced. Next slide. Let's look at another scenario where you have an LPR or green card holder who is receiving Medicare Part D low-income subsidies, and then they go back they leave the country to go back to take care of a sick relative. So if they did that, as we shared, the LPR is not generally subject, once you get your green card, you're not generally subject to the public charge test. However, if you leave for more than 180 days, then you would be subject. So the possible negative factors that might be considered, if they're receiving Medicare Part D, likely they're over 61, so that might be considered a negative factor. Whether or not they have some kind of serious health condition, that may also be considered a negative factor. And whether or not they had a job, if they're unemployed, that may be looked on negatively. And again, in terms of their limited English proficiency, that could also be considered a negative factor. Let's go on to see what would happen. We just wanted to share another scenario, and with what might happen if you had a mixed immigration status family. That is, maybe some of the members of the family, maybe a citizen, maybe an LPR, and some may be trying to adjust their status. So the important thing to remember is that only the benefits used by the person seeking to adjust their status will be considered. So if you're a parent and you have not received benefits, but maybe your children have, maybe your U.S. citizen children have, and they, let's say, are using Medicaid. When the parent is trying to adjust their status, the use of the children's benefits should not be considered, and so that should not affect and cause the public charge test to be triggered. So we wanted to share this because I think there's just a lot of misunderstanding that comes when you have a mixed status family. And we have heard, again, that a lot of people have been afraid to enroll in these programs or actually disenrolling. So we want to make sure people understand that it's only the person that is seeking to adjust and whether or not they use the benefits that would be considered. And also to reinforce that even though, there's all those exceptions that Megan went through, there is that chilling effect. So we want to make sure that people understand that if you are one of those exceptions or and not subject to the public charge, then, you should stay in your programs and use your benefits. Next slide. Now, we want to also, we know because people are not sure what kinds of messages to be sharing with our communities, we wanted to share a few that we think are very important. The first one is that the proposed rules are not yet finalized. They will take months to become effective and final. Even when they're finalized, it'll take at least 60 days for them to become effective. And so right now, the current public charge test is being applied in the U.S. And so, you know, we don't know how it may be changed, what the final rules will be, because it may be different than what they are now. But right now, we should be telling our community members that, you know, we should be using the current test. And also, as we've been repeating, enroll in any public benefit program, continue using those benefits, and do not disenroll from any of those public benefit programs. Also, the public charge test will not be retroactive, so immigrants using benefits now should not be affected. When we mean that it's not retroactive, that means only the use of benefits after the rule becomes effective will be considered. Again, the public charge test is only assessed when a person tries to enter the country or become an LPR, adjuster status, and it doesn't apply when you're applying for citizenship. Again, this is an area that we think is a cause of great confusion. And then also, only the benefits that we've been talking about, those health, nutrition, and housing benefits, are the benefits that will be considered. Heng Lam went through a list of the other benefits, so we have to make sure, because they've been mentioned in previous regulations, that our community members know that those programs, only the ones that are listed in the proposed regulations will be considered. Next. So there's also some just general points that you can share to policymakers and for your comments. First, we want to just make sure that people understand that this is just another attack, like a lot of previous ones by the Trump administration, that makes our community members make a difficult choice, an impossible choice really, between keeping their families healthy and reuniting with their loved ones. We would argue that staying in this country should not depend on what you look like or how much money you make or where you come from. It should be how much you can contribute to your community and how you live your life. As we know, family has been a cornerstone of this country's strength, and we deserve the right to stay and reunite with our loved ones and to use the programs that we're eligible for to ensure that we are safe and thriving. Now, as I said, the proposed public charge rules will likely ensure a weaker, poorer country, and it would be devastating not only to immigrant families, but also to just American families across the U.S. So with that, I'm going to just turn it over to Jessica, who could tell you what you can do about this.
Hi, everyone. Thank you for having me here. I'm Jessica. I'm the Communications Director over at Asian Americans Advancing Justice, Los Angeles. So now that you have all of this wonderful information, you're probably sitting there wondering, what can you do about this? Well, I'm here to solve that question for you. So next slide, please. Great. So first step is that you can submit comments. Okay, so there are two options that we would advise you to take. So one option is to submit individual comments through an online portal such as Advancing Justice's portal, whose URL is listed right there on the slide. When you submit through this online portal, I would urge you all to please make an effort to customize your comment. It's very important that we send in as many unique comments as possible so that they're all counted. Even changing just one sentence in the pre-populated template will make a huge difference in its ultimate effect. So again, please submit individual comments through this online portal and take an extra 30 seconds or 1 minute to customize even just one sentence for submission. And the second option is to submit an organizational comment online at regulations.gov. So this is the site where the public charge proposed rules are hosted, and you can find the rules and submit a comment. Even though there will be a word limit on that comment portal on regulations.gov, it doesn't matter because you can attach a comment. So you can feel free to write a longer length comment for your organization and attach it online there. And just to let you all know, Advancing Justice is working on an organizational comment template that we will be happy to share to webinar participants once it's finalized. Next slide, please. Great. Another way that you can help out is by, of course, sharing your story. So really, this movement to stop these new regulations from coming into effect are really more powerful with stories. And, you know, any type of story will do. Anecdotal stories, composite stories, anonymous stories, or, you know, anything else that will protect the storyteller, the story sharer, is something that we would still be interested to hear about because public officials and the media, they all still need to understand how this kind of regulation will really affect the Asian American Pacific Islander community. So if you do have a story to share, we do have a story collection portal that you can feel free to enter your story into, and we'll help follow up if you're submitting a story on behalf of someone else, and we are happy to gather stories from there. And if you or someone you know really does have a story that you not only want to share, but take to the next level, we would also be interested to see if you or that story sharer would be interested in being a plaintiff for any potential litigation we may do to challenge this rule. So if you have a story, great, please share it with us. But if you have a story that you want to really take action with, please contact us privately to see if you would be interested in being a plaintiff. Next slide, please. And also, you can call your member of Congress. So there is the Congress switchboard line. If you don't happen to know who your representative is, you just call that number and enter in your zip code, and they will connect you to the right people. And this is just a short little script for you to say to your member of Congress. And really, this fight is not over. They should be able to take action in some way as well. So please call them, please submit a comment, and please share your stories in order for us to really fight back against this proposed regulation. And next slide. And finally, there is going to be a week of action from November 13th to November 16th, organized by the Value Our Families campaign, which is a national campaign that seeks to protect and defend family-based immigration. It will involve a lot of digital activities, and it is still being planned, but everyone who is participating in this call, in this webinar, will be informed of the action items that are taking place during that week of action. So stay tuned for all of these updates in your emails in the coming weeks. Thank you. And so next slide, I believe, is resources. So here are a lot of different fact sheets we've developed, Know Your Rights resources, talking points, and a blog about the impact of the public charge rule that you can use and you can share widely. In addition, for the community education fact sheets, they are currently being translated. So I would advise you all to visit that webpage often to check on the updated in-language fact sheets. Next slide. Sorry, next slide. Okay, great. So here's all of the presenters' contact information in case you had more specific questions about any of the content that we presented in our slides. You can feel free to reach us through here if you did not want to ask a question during this webinar. And next slide.
Great, thank you, everybody. We'll now open it up for questions. It looks like we have a few right now, but if you'd like to ask a question, feel free to type it in the chat box or raise your hand in the dashboard. And our first couple of questions are, will the slides be available after the presentation? And I believe we will share the slides, and we'll also be sharing a recording. And you'll have access to the slides so that you can click on the links. And then the next question from Connie Lowe is, do we have clarity on how long refugee or asylee status lasts before the public charge applies? Refugee resettlement agencies are only funded by ORR to assist refugees for 3 months after arrival, and federally funded refugee medical assistance and refugee cash assistance only lasts for 8 months. So what happens if an asylee or refugee applies for Medicaid in month 10? Does refugee or asylee status remain valid for this duration? So I guess, Megan, you can start.
Sure. Hi. So refugees and asylees adjust their status to green cards through a special refugee and asylee program. After, well, they're supposed to do it after one year in the U.S. But I know some people do it later. But so they should be never be subject to the public charge rule, because they're not adjusting their status through family or employment. So they should never be subject to the public charge rule. It's more other categories that that can get backlogged and have a wait to get a green card that might, where I believe the UNT visas, where people might say, hey, I can do this faster through my spouse, my US citizen spouse, and where they would then become subject to public charge. But I don't think refugees and asylees are likely to do that, because they can more easily get their green cards through the refugee and asylee program.
Great. And it looks like, Mira, you have a question. I'm going to unmute you. Mira, are you there with your question? If not, that's okay. We also have a question from Marlena asking if there's any clarity on how far the new public charge test will be looking into the future.
Hang Lam, do you want to take that question?
Hang, are you there?
Yes, I am. Can you repeat that question again? I wasn't clear about it.
Oh, Is there any clarity on how far the new public charge test will be looking into the future?
Well, the new public charge test really will not come into formality until the rules are finalized. So it is not going to look back on public benefits that have been used prior to the finalization of this proposed rule. I'm not sure if that's an answer to the question.
Yeah, I'm not sure either. Maybe they're looking at the forward-looking test where likely the question of are you likely to become a public charge in the future? And I think, you know, I don't think there's an answer to that. I think it's just more like if you think about it, all lawful permanent residents become eligible who aren't already eligible, but most of them become eligible for example, for Medicaid after 5 years. And I just think if they're looking at people who are on that path and lower income or they know they already have health problems or disabilities, they're going to predict that they are going to, in fact, take Medicaid in the future. I mean, that's just like an example. But, technically they could look 20 years in the future probably, but I don't think there's a limit.
Perhaps one of the question might be referring to, I guess, what you might call a look-back period after the, after the rules become finalized. So the receipt of the benefits, above a minimal threshold, which is there's a formula in there, looks back at the 36 months prior to applying for status. So, so it would be looking back 36 months. But let's say if the rule got finalized on January 1st, 2019, you'd have to wait. The look back period theoretically would be January 1st, 2022, right? 3 years. If my math is correct. That they could. Let's say if you were applying in 2022, then they could look back. To 3 years. But that may, I don't know if that was the question that she had about, how long you would look back.
Oh, thanks. She says the question was answered, so thank you.
Okay.
And Young Jin, did you want to ask your question?
So
Oh, are you there?
hello?
Yeah. He's just gonna go.
Oh, sorry. I think they have an echo, but the question is, since we have a lot of LEP communities, is there a provision to submit in-language comments? Jessica? Jessica or anybody else?
Hi. I'm sorry. Could you repeat that question?
Is there an option to submit in-language comments for LEP communities?
Actually, there is not currently an option to submit comments in language for LEP folks at the moment. But I think that there could be other options, and I would love to follow up with this person afterwards about that.
Great. We'll send you the name and everything, Jessica.
Great. Thank you.
Just to add on to that, I think we are looking for anybody who has clients who might be wanting to, have clients who want to submit comments in their own language. It would be wonderful if those organizations could help us translate those and then submit the English version. All of the comments have to be submitted in English. We are trying to find volunteers to translate if we receive any in-language comments. So we're trying to find a solution to this because we know that there may be some people who might want to submit comments in their own language. And so we're trying to see if we could provide some translations for those comments so that, yes, as Jessica said, they should contact us about that.
Hi, this is Heng Lam. Also, if you're in the state of California, so I agree with what Dorina said. Submissions must be only sent in English, but the state of California Advancing Justice is a member of a coalition protecting immigrant families, and I think we are trying to find or have some funding to translate some community comments that have been written in other languages into English. So I don't know who asked that question, but if you live in the state of California, there could possibly be some funding to do that.
Thank you. Next question is, can you talk a little bit about sponsor deeming?
So this is Megan. I'm not sure which part is your question. I mean, we know that consulates are already getting stricter about who files the affidavits of support. For example, if the U.S. citizen child is sponsoring the parent and that person's young and doesn't make enough money, it's pretty common. Like we had a client where her cousin, also did an affidavit of support with his income so that they could meet the income thresholds. And it sounds like they're saying the relative has to be close now, but I don't know exactly what the parameters are. I do think if the person's not related, it's going to be a problem. And then that's combined with the way that they're, if that person's in the household, then they're looking at the way they're counting relatives and looking at just the household income factors. But I think we're going to get more guidance on that in the future. I don't know if anyone else had anything to add about that, the sponsor deeming.
This is Dorina, just to add that in terms of sponsor deeming or having the sponsor having to pay back any benefits, we have not actually heard of that happening yet. So, but the idea, as Megan was pointing out, that if the sponsor's income can be considered to help the applicant meet the poverty guidelines, meet the minimum income threshold of 125%.
So the next question, I think Jessica and I can take that. It's, do you have a link to materials we can share with our communities, like social media templates, graphics, etc.?
Yeah, so we do have sample social media posts as well as sample images that you can manipulate that are ready to share. And I can be sure that that's in any follow-up email to this webinar.
Great. So I think that is all the questions we have. So thank you very much for joining us today. And of course, we're happy to answer any additional questions you may have. Our contact information is provided, and Thank you again for joining, and have a great rest of the day.